Really love working with patients one-on-one for diabetes medication management. But I'll pass it over to Jessica if you wanted to introduce yourself to the class as well.
Yeah, thanks, Jennifer, and welcome back, everyone. I met all of you last week. So I'm Jessica. I'm one of the registered dietitians and diabetes educators, and we will be going over today. I'll be talking about reducing risks, which is one of our self-care behaviors. And then the first part we just want to check in on is everybody did set a goal last week. We just wanted to open up the class just to check in to see, how your goal went or if you were able to try it out this last week. Is there any updates from anybody?
Well, last week, I stated my goal was to walk after meals, and I did do that a couple of evenings. I must say I didn't do it for all my meals, but I did do it for a couple of meals. My husband and I went out to dinner, and then we would walk. We basically took the very long route to the car, so which kind of helped incorporate some walks. So good about it.
Yeah, Annie, that's great. And it's all about, like, these goals are about setting intention, keeping it on the forefront. And as you practice it, think about it. It really helps to trigger behavior change and also supports good blood sugar control. Even if you don't accomplish it, however many days you said, it's the doing it and trying to stick with it can help to create those long-term benefits. So sounds like you had a great week. Do you want to continue that same goal, or is there another area that you'd like to focus on?
I definitely want to try because the nutrition has that the like with quarter of starch and quarter of protein and half fruits and vegetables. I'm trying to do that, but that's harder to do, I think.
Yeah, great. Well, I mean, that's adding that in with the walking and just with that intent of just being mindful of portions will also continue to help. So that sounds like a great goal to add into your list.
Thank you.
Yeah, thanks. Henry, did you have a goal or do you want to share how your goal went last week? Yeah. Yeah, Henry, thanks for sharing. It can be really frustrating when you're trying to eat healthy, trying to add things in, and you're not getting the results maybe as you expect. But just what we chatted a little about this last week is we have some factors that are controllable, like the diet, the exercise, the sleep, the stress, but there's actually, I think it's 42 factors that actually impact our blood sugar. And so, once the diet and exercise and those controllable factors are satisfied and we can't optimize them, then using some of the other factors, like looking at medications or other areas to help to improve blood sugar, is also another piece. And then, if you're feeling like you want a little bit more guidance with the diet, I would recommend maybe meeting one-on-one with the dietitian or the diabetes educator so we can take a deeper dive into your foods, your choices, and kind of give a little bit more individualized recommendations. Yeah, surgeries can definitely impact blood sugar. Well, I can reach out, Henry. I can reach out to your primary care doctor and check in it to see if you can get a referral so that we could meet one-on-one. Yeah, I'll see you next week too. We'll talk about more nutrition next week also. Yeah, thank you. And it looks like we have one more participant who logged in, but I don't see that person here. So maybe they will rejoin here in a few minutes.
Awesome. All right, then we have a pretty small group. So we're just going to get started. We want to be mindful of your time. So thank you both for sharing your goals. It was really nice to learn from you, and I'm glad you were able to kind of tackle some progress on that just in the past week. And again, if you weren't able to fully reach your goal, I think often we set goals with really high expectations for ourselves. So really it's about building confidence, starting with something small that's sustainable, and it's going to be the small changes over time that's going to lead to the big ones. Just leave it there, and then I'm actually just going to go back one slide. This is the same information that was shared last week, but you should already have received a link in your My Health messaging section in your app, and you should have access to all of these slides. So feel free to take a closer look later on. You don't have to write down everything that we're presenting. You should have reference to the slide deck later. We love participation, and it's a small class today. So if you feel comfortable sharing, we would love to hear from you. We also have a chat box. Both Jessica and myself will try to do our best to keep an eye on that while we're presenting. Also, we have our website at Stanford with more resources, and just wanted to kind of leave this housekeeping information here. So I will be teaching the first half of class. We're going to start off with diabetes medications. As a pharmacist, this is really my area of expertise, so definitely want to make sure we're all knowledgeable on what are the available options out there. Even if you're not really keen on taking medications or your doctor hasn't prescribed you any, it's still nice to know kind of what are the options, since this is really a rapidly growing field. So we're going to start and jump right in. Hopefully after this segment, we'll be able to go over your diabetes medications and the purpose of the medications, go over some proper storage and transport. If you are taking any injectable medications or considering that, we'll also talk a little bit about preparation and self-administration. And then lastly, we'll go over some potential issues and barriers to taking medications, which could affect our ability to stay on top of our meds. It can be kind of challenging.
Okay, this is what usually happens. I haven't touched anything.
Okay.
Oh, welcome, Beverly. Thank you so much for joining class.
There you go.
Okay, so now I can say okay?
Yes.
Okay.
Okay.
Now you're in.
All right. I think we have our another participant. Beverly, can you hear us okay? Might be on mute. Okay, well, welcome, Beverly. Thank you so much for joining class. We're actually kind of in the middle of our presentation, so we'll keep going. So in terms of medications, they're not intended to cure diabetes. So there's no actual cure for diabetes, but what they are intended to do is to delay or prevent any health complications by keeping your blood sugars in a controlled and safe range. So medications can help lower your blood sugar levels or can help stabilize your blood sugars. Many medications can be taken together, and they actually work together in different ways. So by targeting different parts of the body, there's actually a better synergistic effect overall. We also know that diabetes is a progressive condition. So as you get older, as your body changes, the diabetes can change as well. And so your need for certain medications can change over time. So there's also some added benefits of diabetes meds. So historically, we're taking these medications to lower our blood sugars, but we actually have medications that can also help you achieve weight loss goals if that's something that you're interested in. We also have medications that can reduce the risk of heart attacks and strokes, and also prevent or decrease the chance of developing kidney disease. So we say a lot of our medications nowadays have heart protective benefits and kidney protective benefits, which is really nice, right? It's kind of like hitting two birds with one stone while we're also lowering our blood sugars. We know diabetes can increase the risk of other health conditions, such as heart or kidney related issues. So your doctor may have prescribed you other medications for that as well. So this can include preventative medications like statins. Statins are just a class of medications that help to minimize cholesterol production in our body. There's also aspirin. This is a blood thinner. Most adults do not need to take a daily aspirin, but if you have a history of heart disease or stroke, for example, sometimes your doctor may advise you to take that. Blood pressure medications. High blood pressure is fairly common, among the adult population in our country. So we do have a lot of medications that can help with that. And something that we, I think, often forget, but should also keep in the back of our mind are vaccinations. So the American Diabetes Guidelines actually recommend certain vaccines that we want to stay on top of every year, including the flu shot, pneumonia shot, COVID, and also hepatitis B. And so I put together this slide just with various different pictures of diabetes medications. This is definitely not comprehensive. It's not everything that's out there, but just wanted to show there are different formulations, right? We have our metformin tablets, we have our Ozempic injections, we have different types of insulin. So there's really a lot out there on the market right now, and it can be kind of challenging to kind of understand which agent is most appropriate for your situation. If you're wondering how the medications work, they actually target different parts of the body. So again, more so for your doctor to think about, but if you're ever curious, on the top left, we have medication that can target the liver, which will reduce the amount of glucose that the liver releases. There's also medications that can work on your muscle cells and your fat tissues to improve the sensitivity of cells to insulin. And there's also medications that can target the pancreas to help your pancreas produce and release more insulin on its own. There's medications that can slow the breakdown of food in the stomach. So it basically makes the food in your stomach sit there longer so you're not as hungry. And over time, you notice some appetite suppression as well as some weight loss. And then lastly, on the right-hand side, we have medications that can work with your kidneys to help you get rid of sugar through urination. Any questions about this slide or how different medications work before we move on to the different, available classes of meds? Okay. All right. So we're going to start with metformin. You may have heard of metformin before. It's been around for many years. It is a medication that can decrease the amount of glucose that's made and released by your liver. It also makes your muscle tissues more sensitive to insulin. So typically, you'll take it 2 times a day with food, or you can take it once a day if you're just using the extended release formulation. It's beneficial because it can lower A1C by up to 1 to 2%. It's considered weight neutral, it's low cost and generic. But there are some side effects to look out for, including upset stomach, diarrhea, or bloating. So we do recommend taking it with food to minimize the side effects. Next, we have our class of medications called the SGLT2 inhibitors. You may have seen commercials for some of these agents, such as Jardiance and Farxiga. These are medications that target your kidneys to help your kidneys and your body urinate out extra glucose. Typically, you'll take it once a day in the morning. We do recommend taking it on early in the morning because the later you take it, the more it may potentially disrupt sleep if you do need to go to the bathroom overnight. It can lower A1C up to 1%. Sometimes we notice a little bit more A1C reduction than that. It is one of the agents that has kidney protective benefits as well as heart protective benefits. So that means that it will slow down the progression of kidney disease. It will also reduce the risk of future heart attacks and strokes. And because it helps you get rid of extra volume, like extra fluid, it can also help lower blood pressure and some weight loss as well. Side effects, as you can imagine, it can increase urination, possibly changes to your electrolytes or kidney function. So your doctor should be checking some blood work after starting these medications. And it can also increase the risk of UTIs, simply because bacteria love to feed on any sugar that gets spilled into the urine. Moving on, we have our GLP-1 receptor agonists or GLP-1 medications. These are definitely becoming more popular, and we're prescribing them a lot more often now for a variety of different indications. But these are medications like Ozempic, Mounjaro, Trulicity. You may have seen commercials for them on TV as well. These are very effective medications because they stimulate the release of insulin without increasing your risk for hypoglycemia. So by causing your body to release more insulin on its own, that's going to naturally help lower those blood sugars, but it doesn't have as high of a risk of hypoglycemia as some of the other medications. It also reduces the amount of glucose that the liver makes, so just naturally, it's not going to, cause your liver to put out as much glucose overnight, which will help lower your blood sugars. And it also slows down gastric emptying or digestion. So that means that food tends to sit in your stomach for a longer period of time. You're less hungry, you eat less, and then you notice some weight loss as well. So typically, depending on which formulation you're prescribed, you would take it once a week in your stomach, usually as a self-injection at home. If you're a little bit, worried or you're not used to taking injectables, there is also Ribelsis, which is an oral tablet that you'll take once a day in the morning. These medications are quite effective. They can lower the A1C up to 2%, help with weight loss. Certain agents can reduce the risk of heart attacks and strokes as well. And then some side effects include upset stomach, nausea, diarrhea or constipation, and potentially some decreased appetite and weight loss. Next, we have our DPP-4 inhibitors. So these are actually oral medications that work by causing your pancreas to release more insulin. It also reduces the amount of glucose that your liver makes. Typically, you would take it once a day with or without food. It can lower your A1C up to 1%. These are generally very well tolerated agents. So sometimes we like to choose, one of the medications from this class because there's no risk for weight gain, no risk for low blood sugar. And again, the side effects overall are quite rare with these medications. Next, we have our insulin secretagogues. So that's just a name that kind of describes several different medications that can help your pancreas release more insulin on its own. So a couple examples are glipizide, glimepiride, repaglinide. If you're taking any of those agents, they're basically working to cause your pancreas to release more insulin. Typically, you'll take it once a day or twice a day before meals, depending on how many meals you eat. It can lower the A1C up to 1.5%. It mainly helps to lower the post-meal blood sugar. So if you're worried about, certain carbohydrates or certain food that will spike your blood sugars after you eat, it could be a good idea to take one of these medications beforehand. They're also low-cost generic medications, so they should be pretty cheap, and they can also cause side effects. Most commonly is low blood sugar if the dose is too high for you or if you're taking it on an empty stomach, and potentially a little bit of weight gain as well. Next, we have our TZDs. The only medication in this class at this time is pioglitazone. This is a medication that will make your muscle tissues more sensitive to insulin so that when your muscle cells kind of open up after the insulin binds to it, it can take in all that extra glucose a little bit better. It also works by decreasing the amount of glucose that's made by the liver. You typically take it once a day with or without food. Can lower A1C up to 1.5%. Again, it's low cost and generic. But some side effects to look out for is any sort of swelling, weight gain, or fluid retention. So if you notice like puffy ankles, puffy feet after starting this medication, that is something you want to let your doctor know about. And if you have a history of heart failure, we also want to be careful about taking these medications due to the increased risk for fluid retention. And those are all of our non-insulin options. So, definitely a lot to think about. For those, insulin is still pretty common. We sometimes we may need to prescribe it either because the body isn't producing enough insulin on its own, or if the insulin that the body is making isn't working properly. So we try to give insulin with the goal of mimicking just the natural pattern of insulin production by the pancreas. It can be used either short-term or long-term. So just because you're starting insulin, it definitely does not mean that you'll be on it lifelong. We can always transition you off of insulin to one of those other agents I talked about, if that is our goal. There's also many different delivery methods now. So, we've shown some pictures here. I would say most commonly it's probably the insulin pen. That's a little bit easier to use, and it's a multi-dose pen that you can carry with you. There's the traditional vial and syringe. We also have inhaled insulin on the right-hand side, so that's pretty exciting. Sometimes you can inhale insulin right before you're about to eat. That will help control your post-meal blood sugars. There's also insulin pumps and cartridges as well, usually more so for type 1 diabetes. I won't go through the details, but essentially we just want to highlight that there are different types of insulin. We have long-acting insulin on the left-hand side, and then we have the fast-acting or the rapid-acting insulin on the right-hand side. We also have combination insulin, which is a formulation that has both a long-acting and a fast-acting insulin. So if you're someone who, just wants to stick with one prescription, you want something that's a little bit cheaper, there is combination insulin that kind of combines, both types of insulin into one formulation. If you're curious what, long-acting and fast-acting mean, we have a diagram here to kind of explain that. So essentially, as the name suggests, fast-acting insulin is insulin that acts really quickly, and it gets out of your system pretty quickly as well. So typically, fast-acting insulin is insulin that you would take right before you're about to eat a meal, so that it kicks in within 30 minutes to an hour. It has its peak effect, and then it'll get out of your system after a couple hours. On the opposite hand, we have our long-acting insulin. So that's our long-acting basal insulin. Typically, you'll take it once a day as an injection, and it'll basically last at least 24 hours in the body to give you some nice background coverage. So this is an example of someone's insulin regimen. So in this example, our patient is using one shot of the long-acting insulin at bedtime, which will last about 24 hours in their body. And then they also take multiple short-acting insulin injections right before breakfast, lunch, and dinner, and that will help cover those post-meal blood sugar spikes. If you're curious, I think starting insulin can be kind of daunting. There can be a lot to think about. It might sound a little bit complex, but really in terms of the supplies needed, you just need your insulin medication. Often we prescribe the pen, a prescription for the insulin pen needles. We do recommend an alcohol wipe just to clean the injection site, as well as some sort of sharps container or just like a heavy duty household container to dispose of the needles. If you've never seen what the device looks like, this is just kind of a diagram of what the insulin pen device is like. So essentially, there is, a pen-like device. There is a pen cap that you can take off. Once you take off the pen cap, you'll see a little window, which you'll see the insulin liquid inside. And then on the other hand, on the other side of the pen, we have the dosage selector, which is where you can turn the dial to your right dose. And there's also the injector button when you're ready to give yourself the shot. We have our pen needles as well. Again, there is multiple layers just for protection and to make sure that it's clean. But essentially, you would screw on the pen needle to the insulin pen with each injection. I won't read through this, but if you're ever curious how to prepare an insulin pen for injection, of course, you want to make sure that your hands are clean. So use warm water with soap. You'll take the pen cap off of the insulin pen. You'll inspect the insulin pen. You can actually see the liquid inside to make sure it looks ready to inject. And then we recommend cleaning the top of the pen with an alcohol wipe and then screwing on a pen needle when you're ready. Before you do the injection each time, you actually want to do like a test shot, which means turning the dial to 1 or 2 units and then pushing the injector button just to make sure that you see a couple of drops of insulin come out. And then you can turn the pen to the prescribed dosage. In terms of the actual injection, there's several different sites. We generally recommend the fatty tissue on the stomach. That's usually easier for most people to access on their own. You typically hold the pen in your dominant hand, and then with your other hand, you can pinch an inch of skin, kind of like shown in the photo here. And then you'll insert the pen at a 90-degree angle, push the injection button all the way down. You'll feel a little bit of resistance, but it will go all the way down to 0 eventually. After that, you want to count to at least 6 or 10 seconds and then pull the needle straight out of the skin just to make sure you do give it enough time to get all the medication absorbed. Once you're done, you can recap the needle, take off the needle and dispose of it in the sharps container, and then put the pen cap back on the insulin pen, and then it's ready for the next dose. Other injection tips, and again, this is not just for insulin, but also pertains to some of the injectable medications like Ozempic. So the best place to inject is in the abdomen, at least 2 inches away from the belly button. You do want to try to rotate injection sites though. So don't always try to do the same site. That can increase the risk of developing lumps and just make the tissue more sensitive. So just try to rotate sites every time that you inject. If the stomach is not a good place for you to inject, you can also talk to your doctor about other locations, such as the back of your upper arm. There's usually some, fatty tissue there for injection, or you can also do the outer thighs as well. Any unused insulin should be kept in the fridge. So when you pick it up from the pharmacy, make sure you put it in your refrigerator, especially when it's getting hot right now. But any insulin pen that is already in use can actually be kept at room temperature. Pen needles are considered sharps, so they should be disposed in a hard plastic container, and then you can dispose of the container through your county's hazardous waste program. And so this is just a chart that we put together in terms of how to choose the right anti-diabetic medication. So we talked about medications that have heart protective benefits, kidney protection benefits. So if that's something that you feel would be beneficial in your situation, there are certain medications like the GLP-1 injectables that may be preferred. If cost is a concern to you, you may want to go for something that's more generic and low cost, such as metformin or some of those other generic oral medications we talked about. But there's a lot of different considerations and characteristics for the medications, so that's why we put together this chart into our slide deck. And we know taking medications can be challenging. Life is busy. It can be hard to stay on top of our different medications for different conditions. So we just put together a list of questions that we hope that you would understand about your medications. And if you have any concerns or if you're not sure, you could definitely ask your doctor or your pharmacist. And we also recommend bringing all of your medications or labels when you go to the appointments. Medication challenges. So we want to go over some strategies to help with medication adherence and remembering to take medications on time. I will pause here. Does anyone have any tips or any strategies that they use at home to help them remember to take their medications? And feel free to unmute yourself if you'd like to speak or put it in the chat.
I actually found that if the medications that I have to take both 2 times a day, that when I take the ones I need, even for the morning, I turn the bottle upside down. So I know that in the evening I've already taken that one.
That's awesome, Beverly.
I tried using the boxes and the little dailies, and it just never worked for me. So
Okay.
that seemed to work.
That seems pretty simple, though. Yeah, that's great.
I use the pill box with the calendar, with the Monday, Tuesday, Wednesday. I do use that, and I have a morning one and a nighttime one.
Okay, so it looks like it works for Annie, very organized with 2 different pill boxes. For Beverly, didn't quite work for you, so you kind of turned the bottle upside down.
That's a
Um,
good
yeah, that is a good idea, Beverly. I actually haven't really thought of that, but I should probably add that to the slide. So that's why I love teaching these classes, because even though I've taught so many times, we always learn something new. Um, but those are some great strategies. Thank you both so much for sharing. So pill boxes, or maybe some kind of system where you can make sure that the bottle is kind of noted that you already took the dose for the day. Some other tips is like scheduling your meds with other daily activities. Like, for example, we already think about, I guess we don't really need to think about, we just do it, brush our teeth every day. So you can kind of associate your medication with that habit. Reminders are great as well if you like to do alarms on your phones, your smartwatches, or if you even live with family members who can, remind you, and you guys can tag team and help each other out. That's also really nice. Lots of different strategies. So love, just learning from you guys on that. And then there's also other resources. We know adherence is, one part of the picture, but, cost is also a big concern, right? If the medication is too expensive, that's not going to be sustainable long term. So we do want to educate, patients that there are medication assistance programs. Certain drugs also have manufacturer copay cards, and also GoodRx. If you haven't used GoodRx before, it's a website that's free. You can type in the medication you need, and sometimes you can find some nice discounts to show to the pharmacist. And I actually look in the chat right now. Let me pause there. I do see Henry has a question. Is it true that taking metformin affects the kidneys long term? Great question, Henry. I actually do get that a lot from our patients. I think there is a lot of information out there about metformin and, how it affects kidney function. I will say it is not true. Taking metformin long term will not affect the kidney function. The concern is that metformin is partially metabolized or cleared by the kidneys. So it is important that your doctor is checking your kidney function, before you start the medication and during therapy, and adjusting the dose if needed if your kidney function does change. So meaning that we do need to adjust the dose of metformin based on your kidney function, but it does not directly damage your kidneys long term. Question 2, would injection like Ozempic or Wegovy be better since it does not require metabolism, go straight into the body? That's a great question, Henry. These medications still do get metabolized. It's just much, at a slower rate because it goes into our subcutaneous fatty tissue. So I wouldn't say that, it's necessarily better in that sense. But I will say most of these injectable medications do not need to be, I guess the dose does not need to be adjusted based off the kidney function. So generally in that sense, we don't have to worry so much about checking your kidney function regularly like we do with metformin. But I do think the Ozempic and the Wegovy medications, those are just generally more effective at lowering the A1C and also help with weight loss. So those are really some great medications we have now for the diabetes. We'll love the questions. We're actually right at the end of our medication section. So feel free to let me know if you have any other questions. Otherwise, you can also drop them in the chat as well.
Thank you.
Awesome. All right. So if no other questions right now, we're actually going to just dive into the second section, and then I'll pass it over to Jessica for the second half of the presentation. So we're going to go over reducing risk now. So we talked about what medications are available. Now we're going to talk about what are the risks of uncontrolled diabetes and how can we prevent them long term and stay healthy. So after this segment, we'll be able to go over the diabetes-related complications, describe the name and frequency of the necessary tests, and also go over the recommended goals. So we actually have a pop quiz, which is kind of an activity for you all. So we have a statement here. We want to think about how can we rephrase this statement so it's a little bit more accurate. Originally, this was, designed as a true or false question, but, if you think it's true, you can let us know that. But if you feel like there's a different way that we can rewrite this statement to be a little bit better, feel free to drop them in the chat as well. So the statement is, diabetes is the leading cause of adult blindness, lower limb amputations, and kidney failure in the United States. Is there a better way to rephrase the statement? Feel free to let us know. Do you guys think this statement is true or false?
I think the bluntness of it is good.
Awesome. Okay, Beverly, so you think it's true? It's correct. Anyone else? Yeah.
I think the statement is very direct and to the point, so it is what it is.
Okay. Thank you guys so much for the participation. We love it. So yes, you probably have heard, diabetes can cause these things. Obviously, sounds very scary. Definitely complications we don't want. I would say it's a little bit of a trick question because what we want to emphasize is it's unmanaged diabetes that can lead, be the leading cause of these preventable complications because well-managed diabetes actually does not lead to anything. So you guys are absolutely correct in, understanding the association between diabetes with these complications. It's a little bit mean of us, but we really wanted to emphasize that as long as your diabetes is well managed, your risk for these complications is not any higher than someone who does not have diabetes. So the goal is to keep our blood sugars in a safe range and reduce the complications from the high sugars. So now we're going to go over, different types of complications, what we can do to prevent it, what to look out for. We know unmanaged diabetes can lead to complications. So how can we avoid that? Really, it comes down to maintaining excellent blood sugar readings, performing the recommended test, and seeing your care team regularly as well. So what are the complications we're most concerned about? So again, I know this slide can look a little bit overwhelming with the different types of complications listed. We really just wanted to emphasize, high blood sugar over time. It's actually a little bit toxic to the body because it affects different parts, different key organs. So we're talking about heart attacks, strokes, kidney damage, changes to our vision. I know Henry has talked about, some eye complications with the blood sugars, nerve damage, foot infections, dental and gum disease, as well as liver diseases. So these are just some complications, and then we're going to go into the individual ones and what we can do to reduce our risk. Okay, so we're going to start with a big one, which is preventing cardiovascular or heart disease. So why does this matter? Studies have shown that people with diabetes are more likely to have a risk of heart attack or stroke, but diabetes is actually one of the 7 controllable risk factors for heart disease. So other than lowering your blood sugars, what can we do to reduce our risk? Quitting smoking is one of the best things you can do to also reduce the risk of heart disease. Increasing exercise, we've talked about physical activity last week, trying to get more movement in. Managing weight, so trying to keep our weight in a healthy range for our height. Taking medications to protect the heart. So for example, statins, right? These are medications that will reduce cholesterol, reduce the chance of a plaque from forming in the blood vessels. So that can be really beneficial. Your doctor should be checking your cholesterol levels at least once a year and also monitoring blood pressure on a regular basis if necessary and taking medications if needed. Next, we have kidney damage. So diabetic kidney damage is also known as diabetic nephropathy. We do know that this is the leading cause of kidney failure and dialysis in the country. Other than controlling our blood sugars, what can we do? There is lab tests that can screen for signs of early diabetic kidney damage. So your doctor may have ordered you what we call a urine albumin to creatinine test. Basically, they'll have you, pee in a cup, get a sample of your urine, and they are checking to see if there's any protein that's spilling into the urine. If there is, this is considered microalbumin. That's what we call the protein that's spilling into the urine. At this point, it's still reversible. So really getting those blood sugars in a safe range will help to reverse the amount of protein that's leaking into the urine. And the advanced damage is seen later in the blood work, usually through that marker called the EGFR, which is usually in your metabolic panels that your doctor checks pretty normally. So you can think of it as our kidneys. Inside there are a lot of tiny, micro blood vessels. Can't see it, of course, but essentially in a healthy kidney where there's no kidney damage, the urine that we, urinate out, that should be a clear sample. There should not be a lot of protein that's leaking into the urine. But in the case of early diabetic kidney damage, sometimes the blood sugars can actually damage the blood vessels in the kidneys and cause a little bit of holes and little areas where the protein can leak out through the blood vessels and into the urine. So that's what we're measuring. Aside from blood sugar control, blood pressure is also really important. So sometimes your doctor might prescribe you certain blood pressure medications that can also protect the kidneys and reverse this as well. And there's medications that we talked about earlier, like the SGLT2 inhibitors like Jardiance and Farxiga. Those can also help protect the kidneys and address this. Liver damage is also something that we want to emphasize. So our guidelines do recommend screening patients for fatty liver. And why this is important is because we know diabetes does increase the storage of fat in the liver and can cause something called MASLD, which is metabolic dysfunction associated steatotic liver disease. It's such a mouthful to say, but that's just kind of the technical term for fatty liver. We have different stages of liver damage. So you can see we have our healthy liver at the top. Over time, depending on diet or weight gain, sometimes we can cause, some fat to accumulate in the liver. So that's pretty common. It's still reversible at this stage. Over time, if the fat continues to build up, it can increase the risk of liver fibrosis, which is also known as liver scarring. So scar tissue is a little bit harder to address because once our tissue gets scarred, we cannot fully reverse that. We just want to make sure that we aren't allowing it to get worse. Over time, the scar tissue can become cirrhosis, which is like late stage scar tissue. And ultimately, what we're concerned about is the risk of liver cancer or needing a liver transplant. So your doctor should be screening you for liver disease using some kind of calculator tool. It'll plug in your age, your lab values, and it'll basically give us a score. The score will let us know if you're at low risk, in intermediate risk or high risk for liver fibrosis. Depending on which category you're in, your doctor may recommend getting an ultrasound of your liver, which is called a FibroScan, to look for how much fat is in the liver itself. So the main treatment is really just maintaining a healthy weight. It's nothing fancy, but really, if you have fatty liver, guidelines recommend losing like 5 to 10% of total body weight to start with, and that will naturally help reverse some of the excessive liver fat. Those GLP-1 injections I talked about earlier, like the Wegovy, Ozempic, and Mounjaro, those would be some of the recommended agents to help reverse some of the fat that's accumulated in the liver. Okay. And then we also have eye damage. So again, we know there's a connection between high blood sugars and damage to the retina. So unfortunately, diabetic retinopathy is the leading cause of blindness in our country. We do know that the risk tends to increase each year that you have diabetes. But if we can, detect the vision problems early on, this can still be reversible. So you can see in the diagram, we have our healthy eye on the left-hand side. On the right-hand side, in the case of diabetic retinopathy, those little blood vessels in the back of our eye or the retina, those blood vessels get a little bit inflamed, a little bit angry, and that's what we're really looking for to see if the diabetes has caused that. So what we recommend is, making sure that you are monitoring for any vision changes. If you do notice something different, make sure you see your optometrist or ophthalmologist. Even if there's been no noticeable difference, you should get a dilated eye exam at least once a year, just so they can really look in the back of your eyes to see if there's any early signs of retinopathy. We also have nerve damage. So this is called neuropathy. So nerve damage is really important because nerves are all over our body. It can make it difficult for us to detect any wounds, and over time, that can lead to infection. So you probably have heard of, neuropathy, especially in the feet, as well as, wounds causing, infections and potentially leg amputation. So all of that sounds really scary, of course. We obviously want to prevent that as much as possible. So what you can do is monitor for any numbness, tingling, burning, or painful sensations. So I have patients, who come to me and they mention that, they feel like their feet are on fire, or they notice some kind of tingling or burning sensation in the feet, especially at night. Those are some classic signs of, maybe early peripheral neuropathy. There's also nerves in our stomach, though. So any changes in digestion, right? If we're not digesting our food properly, there's some issues with getting food through our digestive tract. That can also be another symptom of neuropathy, as well as changes in sexual dysfunction. So other things you can do aside from lowering your blood sugars is quitting smoking, making sure you get a foot exam at least once a year at the doctor's office. You can also check your feet daily at home just to make sure, there's no open wounds or any cuts, things like that. And if this is really affecting your quality of life, there is medication that can, minimize the symptoms so that you can feel a little bit more comfortable, especially while sleeping. So we actually found this little graphic from the CDC. It's nice to know that, there's actually, some great recommendations on how we can take care of our feet in terms of foot care for diabetes. So, you can check your feet at home every day for any cuts, redness, any open, sores or corns. You do want to wash your feet every day. Make sure you use warm water, nothing that's super hot, and dry them well, especially in between the toes. Don't go barefoot. We don't recommend that, especially if you have neuropathy. If you go barefoot and step on something, you might not know it, and over time that can cause like an open wound or increase the risk for infections. You also want to wear shoes that are, wider, that make sure the toe box is wide enough and your feet feel very comfortable in it. Trim your toenails straight across, and also get your feet checked at your doctor's office. So lots of good tips out there. You can also put moisturizer on your feet after you shower or take a bath. Try to do activities that aren't going to be super hard on your feet. Trying to achieve a healthy weight is also really beneficial because it won't cause you to put as much pressure on your feet. And also, just kind of keeping in a close eye. We do recommend doing a foot exam at home just to kind of do an inspection every day if you can. And then lastly, we also have dental health. So gum disease, we do know tends to be a little bit higher if you have diabetes because that can increase the risk of cavities, gum disease, salivary gland dysfunction. So if you notice, any changes like bleeding gums, sensitive teeth, gum recession, or, loose teeth, make sure you get it checked out with your dentist. We do recommend brushing your teeth at least twice a day. Using dental floss at least daily, checking your mouth for any changes, and making sure you get that routine dental cleaning at least every 6 months. So this is, we kind of went through all the different risks and the complications. It can be a lot to digest. So we put together this table, which kind of summarizes all the tests that your doctor should be ordering for you and what are some of the recommended targets. So last week, you guys learned about the A1C, which is a measure of your average blood sugar over 3 months. So for most adults, we're trying to aim for under 7%, and your doctor should be checking that every 3 to 6 months. blood pressure goal is usually under 130/80. LDL, which is that bad cholesterol, is to be under 70 for most adults. The urine albumin to creatinine ratio, which looks for early signs of diabetic kidney damage, should be less than 30 on the blood test or on the urine test. We also have the fatty liver screening. So the mast cell screening, that should be performed at least every 2 years. Getting the eye exam at least once a year, dental exam every 6 months, exam in the office once a year, or every day at home if you're able to check your feet, and also the vaccines that we talked about earlier. So again, you don't have to memorize this, but I think just as a good reference, this is a really nice summary of the recommended health maintenance exams and tests for diabetes. So with that, we've given a lot of information today, but ultimately you are the most important person on your diabetes care team. So you know your body the best. So if something does not feel right, make sure you contact your doctor or your healthcare team, figure out what's going on so that we can work together to manage your diabetes and prevent any complications. So with that, I will take a pause here. Let me know if you have any questions. Otherwise, we will move on to the next section. Awesome. Well, thanks, Henry. I'm actually going to pause here. I know you put a question in the chat, so I want to make sure I get back to you on that. Yeah, so you had a question. These are great questions, by the way. You had a question about whether you can get the CGM to check your sugar. Great question. It will really depend on your insurance. So if you don't mind me asking, Henry, do you know what kind of insurance you have? Are you on Medicare or do you have private commercial insurance? Oh, okay. Okay. Oh, okay. Okay. Yeah. So what I'm trying to say is that insurance coverage, CGM coverage really depends on insurance. So usually for Medi-Cal and Medicare insurances, they will only cover the CGM. I'm just going to put someone on mute. We will only cover the CGM if you're using insulin. So unfortunately, that's one of their requirements. But there is something called the Dexcom Stelo. I can put it in the chat. It's basically an over-the-counter sensor. You don't need a prescription for it. You can purchase it on the Dexcom website. It'll cost probably anywhere between $80 to $90 a month, and that's without prescription. Oh, I put it in the chat. It's called Dexcom Stelo. Yeah. Of course, yeah. Thank you so much for the participation, Henry. I'm going to pass it back to Jessica. I actually need to log off early today for class, so I won't be able to stick through to the end. But any questions, you can, message the Diabetes Care Program, and I'm happy to answer those later. Thank you so much, Jessica.
Great. Thanks, Jennifer. All right. We will go ahead and move on. We have two more areas that we're going to be talking about. Our next area is called problem solving. And we're talking about problem solving because when we are able to solve problems or challenges that we're having related to our diabetes, it helps us to keep our blood sugars in target ranges, helps to reduce the risk of all those complications we just heard about. Problem solving does require planning ahead, thinking, what we're going to be eating or having for meals, maybe when we're going to be monitoring our blood sugar, when to take medication. So this really just breaks it down. If you're experiencing a challenge in terms of, managing diabetes and you're noticing you have a problem or, something keeps recurring, is use what's called the problem solving cycle. It's kind of you first want to identify, well, what is the problem? What's the issue that's happening? Am I forgetting meals, or am I forgetting to check my blood sugar? There's many different ideas here. And then the second step is to really brainstorm and think about what are some solutions that we could really focus on to help address that issue. And sometimes it's helpful to create a plan A, B, or C, and then select one of those solutions to try and test it out, take action to see if that helps to mitigate or reduce the recurrence of whatever that problem might be happening. And then just really using that to evaluate and reflect on, did it work? What did you learn? Is it something that you can continue to do? So for example, This is using this 3-step problem solving to be proactive and prevent a problem. And just as a tool here, example, the problem here is going out to eat, right? We have Mary, she's going out to eat, wants to make sure that she can stay on track to stay on her meal plan. And, she thinks about, 4 different ideas of, okay, what can I do ahead of time to really make sure that I'm sticking to my meal plan? She says I can look at menus before going out and make my decision before I get there, maybe picking a restaurant that has some healthy options, perhaps eating before she goes, something that's balanced with some fiber and protein, or to log it in her food journal to see what fits in her goals. So then of these solutions, pick one and go with it. So she decides to look at the menu ahead of time and plans to order a salad and share a meal. Also plans to skip the bread before the meal. And so really she plans to doing that. It's premeditated and really being proactive to prevent maybe from derailing her diet plan or eating something that spikes her blood sugar above her goal. Another way that you can use this is planning for maybe unexpected challenges. So here's another problem that we have Ben, who's experiencing low blood sugar after increasing physical activity. He thinks of what are 4 things that I can really do to maybe see if I can reduce this from happening over and over again. Cut back on exercise, maybe talk to the doctor about changing medications, changing the time that he exercises, or having a snack that after he exercises and then eating more at meals. He decides he's going to try to exercise before dinner and then follow up with a balanced meal to see if that helps keep that blood sugar more stable. And if it doesn't work, then to follow up with the doctor. There's linked in the slides here, the American Diabetes Association has a lot of other resources and ideas of how to go about problem solving. And so the link is here, it's problem solving tips on the diabetes.org website. Analyze problems. Managing diabetes doesn't mean we have to be perfect or always do everything in this one exact way, but really being a detective and learning from what is happening, learn it in a way where you can correct it in a way that works for you. Problem solving is a process, so if your plan doesn't work out as expected, refine and adapt it for next time. And with practice and mindfulness and being aware of kind of what's going on will help us to achieve and maintain lifestyle and self-management goals and ultimately help protect blood sugars. Some other things we really want to be mindful of with problem solving is listening to your body. You know your body the best. Some signs and symptoms to be aware of is if you were experiencing confusion, dizziness, shakiness. That could be a sign or a cause, that could be hypoglycemia. When our blood sugar gets too low, we can actually feel some of these types of symptoms. Having excessive urination and thirst, elevated blood sugars can contribute to that. Wounds that are festering, slow healing, getting infected, uncontrolled diabetes, so those elevated blood sugars can result in poor circulation and making those wounds not heal appropriately. Blurry vision or pressure in eyes, Jennifer was just talking about that retinopathy, so uncontrolled diabetes can increase risk for various eye conditions. Loss of feeling in our feet, so that would be neuropathy or nerve damage. Swelling in hands, face, feet, ankles, that could be signs that kidneys are not working properly, that the body is retaining more fluid. And then any chest or arm pain, heart attack. So certainly listen to your body. If you're having signs and symptoms, reach out to your providers. We also want to be prepared for the unexpected, so having a diabetes emergency plan in situations like natural disaster, national emergencies. It's recommended to have a portable and insulated waterproof emergency kit that's readily available where you are in your home or wherever that might be. And in that container to include things like documentation of medical conditions, contacts for your healthcare professionals, emergency contacts, copy of your insurance card. And this is in cases where maybe you can't get access to your online medical record or you don't have power to look up any of this information on the computer. So having this portable insulated kit. The ADA also has a nice checklist. If you do want to create your own kit, you can download this checklist, which is also linked in the slides. And then I have a couple other information here about an emergency plan, and it's just a very short video that we'll watch here together.
Are you prepared to manage your diabetes in an emergency? An unexpected event could leave you stranded, disrupting your usual routine and limiting your access to healthcare supplies. Having an emergency diabetes kit can save your life. Take action by putting together a diabetes kit that includes all the essential information and supplies. Here's how to get started. Assemble your diabetes emergency kit in a waterproof and insulated container. This will help protect the contents from moisture, heat, and cold. Work with your diabetes care team to put together a binder listing all of your health information. Next, you'll want to pack some important supplies to have on hand, such as blood glucose testing supplies, insulin, and a prescribed severe hypoglycemia emergency therapy. Be sure to include a 2-day supply of non-perishable foods and at least a 3-day supply of bottled water. Finally, pack a first aid kit along with a pen and notepad to record your blood sugar levels and any new symptoms you experience. Keep your emergency kit in a safe place that's easy to find. And remember, don't pack your insulin until you're ready to go. Check your kit every 3 months for expiration dates on food and medications. Enjoy the peace of mind knowing you planned ahead and are prepared for any emergencies that may come your way. Download the full copy of
All right.
your diabetes.
Lots of information on there. So also listed here on your slide, some additional recommendations is to protect and care for your feet. Keep an extra pair of shoes or socks within your kit so you can be mindful of things like broken glass, which could be around in the situation of such emergencies. Examine your feet regularly for cuts, sores, blisters. Keep your vaccinations up to date. Include an extra charger and batteries in your kit, and then a designated meeting point. All right, and then our last self-care behavior that we're going to be covering is called healthy coping. And the reason why we're talking about healthy coping is because diabetes can be very overwhelming. There is so much to think about. In fact, there are 42 factors that affect our blood sugar. So, we're thinking about lots of other things in our life, but also, taking diabetes into consideration and all these factors. So certainly lots. And, when we have all this going on, there could be some mixed feelings about conditions. Our emotions can affect our ability to manage our condition. And it's not uncommon to feel distressed, depressed due to the burden or long-term demands, fears of long-term problems related to our healthcare needs. And so when we experience stress with managing maybe some of these things, it can be more challenging to control our blood sugars. And as we talked about earlier in Core Concepts 1 last week, stress is also one of those modifiable risk factors. When you're experiencing higher levels of stress, it increases our blood sugar by various cascades of things that occur. And just for fun, stress spelled backwards actually spells desserts, ironically. So sometimes we think about stress as being very negative, but it can also be somewhat positive, as demonstrated in this picture here. When we have a certain level of stress, our performance or ability to achieve things or do things is increased. So for example, we do want a little bit of stress that pushes us to maybe make change, to do something different, to help keep us at our optimal level of performance. And that's called getting to a place of eustress. And so if we are past a level of eustress where we have increased levels of stress, you can see how as your level of stress increases and gets to maybe a place of distress, our performance or ability to cope declines. And so that could be, we really want to avoid getting into this place of distress, which is really why we highlight the importance of a healthy coping. Coping with upsets or stressors in life, things like emotion-focused coping skills, being physically active can help us manage stress, giving yourself a pep talk, meditation, problem-focused coping skills, maybe asking for help, getting support, creating lists if you're feeling overwhelmed with everything you have to do, working on time management. But stress can really impact our body in many ways. As I mentioned, there's a cascade of events that occur. Stress can impact our cortisol levels, fatty acids, it raises blood sugar, it can impact our sleep negatively, it can reduce our good cholesterol. When we have impacts of long-term stress on our body, what happens over time, we have various stress responders which happen in various areas of our body, which lead to pathophysiologic effects. And then those pathophysiological effects can lead to clinical events. And this is chronic and over time. And some of those clinical events could be things like a stroke or myocardial infarction. So managing stress from the get-go is really important. Stress can be chronic, it can be acute. Think about the reasons for your stress, whether it's work or home, caring for others, finances. There's a lot to consider. And then managing the stress. Keep track and identify things that are stressors for you. Make adjustments as you're able to mitigate stress, perhaps saying no to things if you are overwhelmed, steering away from stressful events or activities, asking for help, getting support. Really important, setting aside time for yourself every day. Some strategies to relieve stress are breathing exercises, meditation. Some of the breathing exercises only take a few moments. You can do them anywhere and you feel the benefits within minutes. It actually decreases the heart rate and blood pressure. You can tame stress by laughing, journaling, listening to music, connection with others, seeking counseling, getting good sleep, eating well, being active. We are going to practice here just a 1-minute breathing exercise. This is from an app called Headspace. There's many more breathing exercises which are longer than this or from different resources, but certainly a good place to start is practicing good breathing.
So sitting comfortably, just taking a big deep breath in through the nose, out through the mouth. As you breathe in, noticing how the body expands. As you breathe out, just watching the body soften as you gently close the eyes. And rather than the mind leading the breath, allow the breath to lead the mind. Notice the sensation of the breath. Notice it where you feel it in the body. If you need to, you can just gently place your hand on the stomach. And just following that rising and falling sensation. Nothing else to do. Allowing thoughts to come and go. And when you're ready, just gently opening the eyes again.
All right, so definitely if that was new to you, I hope you enjoyed that. That was from Headspace again, so lots of other options similar to that are available online. So diabetes is complex. Managing it can be energy intensive. It's normal to feel overwhelmed at times or maybe just not even wanting to think about it, which leads to something called diabetes distress and diabetes burnout. Those are two different things. And we can experience this. Diabetes distress is when we are really just feeling overloaded with the demands related to diabetes, and then that can actually lead to something called diabetes burnout. And this is when you just get tired of managing it and then you ignore it. So it's normal to have these feelings, but if you're experiencing this, it is helpful. Focus on the healthy coping strategies and then seek out support. We have depression and diabetes. Depression isn't the same as the burnout or the distress, but people who are living with diabetes are 2 to 3 times more likely to have depression than people who do not have diabetes. If you have any depression-related symptoms nearly every day, you should talk to your doctor or healthcare provider. And that could include some of the things here. It's feeling sad or empty most of the time, decreased interest in activities, maybe not seeing the point of taking care of yourself, trouble sleeping too much or too little, or any thoughts of death or suicide. Get a support plan. Your diabetes educator, your providers, your healthcare team is a great place to start. Family, friends can also help. There's quite a few different Stanford healthcare programs and resources here. We have the Stanford Healthcare Library, which has a lot of different great talks and resources that you can look at or watch, view. We have some other support classes in terms of weight management, and then we have a diabetes wellness group that meets once a month, and many of these are all virtual. And if you are interested in any of these, you can always contact our program for some additional information or ask your healthcare provider for any referrals if you want some ongoing support. And so now kind of our last just kind of poll here is after our class today, is there anything that you feel like, and you already have your SMART goals, but is there anything additional that you feel like you'd like to focus on? And we have some numbers here. Number 1 is nutrition or weight management. Number 2 is exercise. 3, maybe exploring some of the apps. 4, maybe managing stress. 5, emotional support. Or 6, education literature. If you have any of these areas you feel like you want to continue to work on, please just go ahead and add that into the chat box, or you can let me know. And Henry, I see that you want to join the diabetes support group. I will be sure to have that information sent to you. Thank you for typing that in. All right. Well, in our session today, or all together, including last week, we've talked about the 7 self-care behaviors, which are healthy eating, being active, monitoring, taking medication, problem solving, reducing risk, and healthy coping. This is the last slide, so thank you all so much for attending today. If you are joining next week, the class that we're going to be going through next week is carb counting, and I will be facilitating that class, so I will see you all there if you are logged in to join. Feel free to log off or hang up. Our class is done, and happy to stay here if there's any questions. Henry, again, for that question about the medication, for any medication questions, you will have to check with your primary care doctor, any of the providers that are managing your medication.
Thank you. I'll actually be doing session 3 tomorrow.
Awesome. Great. Thanks, Beverly. I see your little kitty cat there, too. Great. Thanks, Beverly.
He's very annoying.
Just wants to be in the screen, see what's going on.
He's a Bengal, so he's not really a cat.
Oh, very pretty.
All right. Thank you.
Yeah, you're welcome. Thank you. And thanks so much, Henry. I will have our team reach out to you and send you the information for the diabetes support group. Yeah. Yeah. I know it's frustrating. Well, I think the other thing you said is a referral to see a dietitian, so I'll make sure I reach out and get that referral put in for you as well, okay? Yeah. All right. Great. Take care. Nice to meet you. Bye.